my FAQ Fab Fridays.
Woo!
LeeAnn Shibuk and my colleague,
Karly Edwards,
Karly
TGIF.
TGIF.
What a long week.
I know, right? Tell me about it. Sometimes you just have to exhale. I like that. Yeah, let it go. So, Karly, we have gotten an FAQ from a doctor.
Okay.
And she was wondering,
Okay.
what are some easy ways to increase production?
Easy ways to increase production.
Like, sometimes we don't know what to pay attention to.
Yeah.
What are some things that she should pay attention to?
Yeah, there's a couple of metrics that are quite easy that you can adjust a little bit that will easily increase your production. I'll go through a couple of them for you guys.
Please do, Karly. Please do.
So one of the things, a huge thing, is make sure no patient is leaving your clinic without a next appointment.
Yeah.
I do not care if that appointment is a filling, a follow-up, a hygiene appointment, anything like that. Nobody should be leaving your clinic without an appointment. So that is called reappointment, not pre-appointment in hygiene. It's reappointment. So
yes.
A lot of times, we're really focused on the hygiene pre-appointments, making sure everyone's booked back for their 6 month,
Yes.
4 month, 3 month, whatever your system is. But people let patients leave from a filling appointment, for example, with no next appointment scheduled.
Yeah, it's so great that you should say that, because when I coach and consult and I go over with the teams that I work with, I say the similar thing. I say it's a golden rule of the office that nobody leaves the office without paying their bill and having their next appointment. Yeah. And I love how you said that, the reappointment.
The reappointment.
That's excellent.
And a lot of it has to do with verbiage that the admin team, for example, is using. Instead of asking if they want to come in, ask when they want to come in. Or a next step further is just give them 2 options for the next appointment.
Yeah, I love that. That's so true. And that is what we give them tips when we work with the scheduling coordinators of simple ways to change the language to get the results.
And by no means do I mean working off a script. I don't want people to be, reading off of a piece of paper or something like that. I don't want it to seem forced, but again, there's just little tweaks, little words that you can use that help that along.
And scripts are good to give you the basic knowledge in your head to go over and over and over and pre-read it and then go off of it from there.
That's right.
I agree.
The next thing is make sure that you have an effective confirmation process. So many practices lose, I don't even know for sure what the percentage, but I mean, we were about 17% probably annually, just from no-shows.
At least up to 17% annually from
no-shows and last-minute cancellations.
A
strong confirmation process will curb these losses. A clinic that I've been working with recently, they had an astronomical number of no-shows and short notice confirmations. We've reduced that down to, not very many in a week. Of course, it does happen, especially in these times, with COVID. You can't have people coming in when they're not feeling well, all that kind of stuff.
We do have a little more
more to do, but if there is a short notice cancellation, hopefully your team are good at kind of filling the gaps, and that can be for another FAQ.
Yeah, it sure can be.
And then the last thing is, use technology to your benefit. There are so many pieces of technology that we can use now. I always like to use the phrase seeing is believing. There's a couple pieces of technology that I absolutely love, but one of is an intraoral camera.
Yeah.
Every operatory, you should have one in every operatory. It's one thing to tell a patient, your 17 amalgam needs to be replaced. Yes. But when you take a picture of that leaking amalgam and you blow it up on the TV in front of them and they see that margin is clearly leaking, it's going to be a no-brainer for them. And I've even seen this happen the other day, actually. This was great. My doctor took a picture of the tooth number 17, pulled it up, and the patient actually said to them, I do see that, and the tooth in front of it looks like it has an old filling too. Maybe we should just replace that one before it gets bad.
Yeah, right.
The patient sold themselves the treatment that they will need in a couple years anyways.
See it.
They could see it. Seeing is believing. So
it's very true.
again, there are a lot of different ways that you can help increase production quite easily with the right systems, the right protocols, maybe the right coach in your clinic to help you. I don't know.
For sure the right coach.
For sure the right
coaches. Yeah.
Sure. Yeah, and we would love to help anyone who is looking for opportunity in their clinic. There are lots of different ways that we can help you. Those are just, like I said, a few off the cuff. And,
a few great tips from Karly.
Yes.
Yeah. So here you heard it here on HD Dental Coaching with Karly and LeeAnn. And we wish you the best weekend. Have a fabulous Friday, and keep sending us your FAQs.
Keep sending us your FAQs. Facebook, LinkedIn. I always forget about LinkedIn.
Our website.
Yeah, you can find us many different ways. We would love to hear from you all.
Yeah. Look forward to hearing from you and working with you in the future. Bye.
Bye.